Okay, well, good afternoon, everybody. Thank you for coming or joining us for this webinar. My name is Dr. Anna Merrill. I am a psychologist at Children's Resource Group, and we're going to be sharing some information today about intellectual disability. So the title of this presentation is Understanding Intellectual Disability, Definitions, Intervention, and Resources. There are handouts of this PowerPoint that have been uploaded to the GoToWebinar, so feel free to download those as well as a reference, and we will go ahead and get started. Okay, so the outline for what we're going to be covering today, we're going to start with talking about what is intelligence so that we really have an understanding of what that word means and how that relates to the diagnosis of intellectual disability. Then we're going to talk about what is an intellectual disability. We're going to walk through how it's defined and also how it's typically diagnosed, including talking about what a psychological evaluation will look like. We're also going to talk about how can we help people with intellectual disabilities, thinking about intervention and other strategies that are important for families, teachers, or other providers working with individuals with an intellectual disability. And then finally, the last thing we'll be talking about today are some resources. So we'll be reviewing what resources will be helpful for people to know about when they're working with this population. And while that will not be an exhaustive list of everything there is to know, I sure hope that that's a good start for anyone looking to gather more information about intellectual disability. So let's start with this question of what is intelligence, because there's often a lot of personal meaning that people might bring to that word. What does it mean to be smart? What does it mean to be intelligent? But when we talk about intelligence from the perspective of a psychologist, for example, we're actually talking about something pretty specific. So there's actually different ways that we might think about intelligence. The first way can be biological. So everybody's given intelligence has some source of biology. There's a limit that is set by your genetics and by your brain that determines level of functioning. And usually we think about that as kind of the limit being that's the most that someone is going to be able to achieve based on their genetics, their biology, things like that. On the right side of the screen, you'll also see what we call social intelligence. And social intelligence is when we think about intelligence across different environments, different contexts, and somebody's ability to perform and do what's required of them in these different environments. For example, some people might think of street smarts as a type of intelligence, somebody who's really good at navigating the world around them. That might be more of a social type of intelligence. We also think of somebody's ability to perform well at work, or somebody's ability to get good grades or have good academic achievement. That's really more about intelligence in response to a specific environment. If we think about how we can kind of combine these two types of intelligence, biological and social intelligence, the overlap that psychologists are trying to measure is what we call psychometric intelligence. So psychometric intelligence is what's measured in a psychological evaluation through a standardized test. So it's related to your biology, it's influenced by the context and the culture, but it's our best way to really measure intelligence. And that is typically what we refer to as an IQ, the score that comes from a psychological evaluation from participating in standardized testing. So with this understanding of that there's a lot of different types of intelligence, as psychologists, we tend to look at intelligence this way. Our ability to reason abstractly, to solve complex problems, and to acquire new knowledge. So if we really tried to boil it down, this is kind of the concrete way that we try to think about when we think about what are we measuring when we measure intelligence, psychometric intelligence, or IQ in an individual when we're looking at their overall level of cognitive functioning. So then what happens when these abilities are delayed? That's when we start to think about this diagnosis of an intellectual disability. So the definition of an intellectual disability is when we see that there are significant difficulties in two areas. The first area is intellectual functioning. So that's what I was just talking about, those thinking, learning, reasoning, and problem-solving skills. But there's also another area that we have to look at when we're considering a diagnosis of intellectual disability, and that is what we call adaptive functioning. And adaptive functioning is more related to some of maybe that social intelligence we talked about before. The way I like to think about adaptive functioning is it is the actual application of somebody's intellectual functioning in their day-to-day life. So we look at social skills, we look at conceptual skills, things like academic performance, and we also look at practical skills, like somebody's ability to get dressed in the morning, for example, or to have a bank account, or something that is the actual application of a day-to-day functioning that helps them to get through the day. So we have to see that there is difficulties in both of these areas when we are considering this diagnosis. Intellectual disability has been called other things in the past. So for example, the previous term for this diagnosis was mental retardation. That term has since been replaced with, in our new diagnostic manual, the term intellectual disability. But if an individual is familiar with this idea of mental retardation, that is the same concept, we've just changed the name in the diagnosis of intellectual disability. The other thing to keep in mind is that an intellectual disability is a neurodevelopmental disability, which means it comes from the way that the individual's brain has developed over time. And as a result, this disability needs to exist in childhood. So it can't be something that is acquired, for example, later in life. So if we think about somebody who's lost skills in their intellectual functioning or their adaptive functioning, maybe because of an injury or because of an illness, we typically would not think about that as a true intellectual disability. Someone who's receiving this diagnosis has had these difficulties since they were a child through their brain development, through their neurodevelopment over time. So when we think about the distribution of any human skill, not just intellectual functioning or cognitive functioning, but any human skill, we typically think about that there are those of us in the population that tend to perform in the average range, and that's going to be the majority of people. And then there's going to be those individuals who are high performers who have above average skills in that area. And then there's going to be those individuals that are low performers, those that have more difficulty with that particular area. So we apply this same concept when we think about intellectual functioning. So the intellectual disability population is this population over here to the left. They're the individuals, the small group of the entire population who's performing on the lower end of the scale of intellectual functioning. And then we might say the opposite end of this curve would represent really high performers, individuals who we might call gifted, for example. but most people are going to fall in that average range. So when we think about an actual IQ score, we apply that to what we call the bell curve. And the bell curve represents the population. So most people are going to fall in that average range, which is why we see that the curve of the bell curve goes up, because that's most people. And then the tails of the curve are small because it's such a small percentage of the population. So when we think about an IQ score, we typically think about that 100 is average, and we consider the average range to usually be around a score of 85 to 115. And if you look at this picture here, you can see that about 68% of the population is going to have a score between 85 and 115. 95% of the population is going to have a score between 70 and 130. So when we talk about intellectual disability, we often use the cutoff of 70 or below when we're looking at an IQ score, because that's falling within that less than 2% lower end of the population. But I want to make a point about something. So if the intellectual disability range is this bottom range all the way to the left, it's really quite arbitrary that we have this cutoff of 70 when we think about an actual person. So somebody who has an IQ score that's falling in what we call the borderline range, which is that range just outside what we call the intellectual disability range. So for example, somebody whose overall IQ score perhaps is a 73 or a 76, that individual may have some traits that are still going to be similar to an individual with an intellectual disability. They might have a harder time learning information, may have a lot of difficulty in school, they might need a lot more reminders to get things done at home. So while we do have to make these cutoffs in how we think about a diagnosis, it's important to understand that individuals who are falling in the borderline range may also have some difficulties that can be consistent with somebody with an intellectual disability. So this is the piece of intellectual disability that includes looking at cognitive functioning, or that IQ score that measures intelligence. But as I mentioned before, we also have to look at adaptive functioning. And like I said, adaptive functioning are the skills that are needed to make it through just everyday life. Okay, so when we think about conceptual adaptive functioning, that often includes language and communication. It includes our ability to read, write, do math. So those academic skills tend to fall under that conceptual area. Our reasoning, perhaps our memory, our ability to hold on to information. So all of that falls under this conceptual area of adaptive functioning, and that's an area that we're going to want to look at when we're considering an intellectual disability, as well as social functioning. So somebody's interpersonal skills, their ability to use language functionally or other forms of communication functionally. Are they able to build friendships with other people? What does their play look like? Are they able to engage in those typical kinds of leisure skills? Do they have hobbies or extracurricular activities that they're involved in? All of that falls under the social realm of adaptive functioning. And then finally, we have more practical adaptive functioning. This is when we look at areas like personal care. So somebody's ability to really get through that morning routine. Can they get up in the morning, brush their teeth, take a shower, brush their hair? How are we doing at a younger age with toileting, for example? So that's going to be all part of practical abilities, as well as just somebody's ability to stay organized, maybe to turn in their homework assignments, for example, to know what their homework is that day. Other practical skills might include out in the community. So an individual's ability to go to a store and make a purchase on their own. It could be somebody's ability to know safety out in the environment. So for example, does somebody know that they should look both ways before they cross the street? Do they understand stranger danger? For an older individual, do they know how to use an ATM to make a transaction, right? So when we think about adaptive functioning, we're looking across all these different areas to get a better understanding of, does this individual have the skills needed to make it through everyday life? Have they developed any of these independent living skills? So when we talk about what does intellectual disability look like, there's a lot of different things that we can think about. So to start up at the top, the first thing that we notice is that learning tends to be more concrete. And in particular, abstract concepts are going to be difficult. So for example, someone with an intellectual disability might do much better with rote learning, learning by memorizing, as opposed to having to think about things more abstractly. So we might see that somebody does better in, for example, early elementary school type curriculum, where we need to remember our ABCs or remember how to count, but might have a harder time when we have to apply those skills to different situations. For example, now we need to read a passage, think about what it means, and answer a comprehension question. That becomes much more abstract and can be much more difficult. We also see that learning tends to be more active and not as passive, meaning that those of us working with or around an individual with an intellectual disability tend to have to be more direct in our teaching, have to be more purposeful, because the individual with an intellectual disability is less likely to just pick up on something by watching or observing. They're going to have to really be taught what to do, and probably repeatedly be taught what they need to do in any particular circumstance or with any particular skill. We also see that individuals with an intellectual disability tend to have a limited use of strategies for learning or problem solving. And so if we only have so many different strategies that we can use for learning, this is actually one of the things that tends to lead to more rigid behaviors, more black and white thinking in an individual with an intellectual disability, because they don't have as many different strategies that they can go to problem solve. So it's a lot easier if things are more predictable and if they know what's coming next. Individuals with an intellectual disability often have a difficult time thinking ahead, planning for the future. Because that's difficult, we might see that they ask a lot of questions about what's coming next, because it's harder for them to keep that organized. They might not be able to think about what's coming in a week. They might really only be able to think about what's coming later that day, for example. So because that's difficult, sometimes those of us around an individual with an intellectual disability need to adjust how we talk about the future as well. We also see that individuals with an intellectual disability tend to have slower processing and slower responding, which means that, once again, we need to adjust and be patient. So sometimes, even though we've asked a question to someone, they might need more time to think about it before responding. And rather than just continuing to ask that same question, we should give them a little bit of time to process that information and to then get their response out. We also see that an individual with an intellectual disability often has a hard time with internal motivation and self-direction, right? So this is where we see that a lot of families will tell us they have to repeat themselves a lot. A lot of teachers might say that they have to provide a lot more direction to get somebody through their day. So for example, even if somebody knows what comes next, they might not have the self-direction or internal motivation to really get up and get going. So we might have to be providing a lot more prompting, letting them know it's time to transition to something new, and really getting them going. And finally, we might also see that individuals with an intellectual disability have a hard time generalizing things that they've learned. That can be across different people or across different places. And a lot of times what this looks like to an outside observer is that there's a lot of inconsistency, because we have perhaps maybe a child who does really well with a certain skill when they're working with their mother, but then when they're at home with another person at school, perhaps they aren't as good at that skill in a different context with a different person in a different place. And so then we can be confused about why is that the case. But sometimes that can be because there's this lack of generalization. So we might have to actually practice a skill across different people and across different places in order to really get to the point where we've mastered that skill. So when we're looking for the kinds of difficulties that we can see in an individual with an intellectual disability, these are the types of things that families and parents will report, that teachers will see, or other healthcare providers or professionals that are working with this individual. I also want to make a point about the difference between an intellectual disability and a learning disability, because a lot of times this can be a little bit confusing, and there is really a difference, especially from a psychologist's perspective, on what an intellectual disability is versus a learning disability. So typically we think about a learning disability, or what we might call a learning disorder or a learning difference, as being difficulty in a specific academic area. So a child with a learning disability might have significant difficulty with reading, for example, which the other term for that might be dyslexia. We might see that a child has a lot of difficulty with writing, or what we might call dysgraphia, or even with math, which we might call dyscalculia. So a specific learning disorder is really talking about that difficulty that is specific to that area of learning. And we typically measure that area of learning through academic achievement testing or standardized testing of that academic area. Whereas when we talk about an intellectual disability, we're measuring overall functioning, right? That overall intellectual ability, that adaptive functioning across all different areas. And of course, as we've discussed, an individual with an intellectual disability may have difficulty with reading, writing, or math, but we have to ask ourselves, is it better explained by overall cognitive functioning, overall IQ level, for example, that adaptive functioning being delayed? Or is it better explained by, no, this is actually just a discrete, specific difficulty with reading, for example, writing, or math? So IQ testing is always going to be a part of how we look at an intellectual disability. But for a learning disability, we're really trying to zero in closely at the actual academic areas, whether that's through standardized academic testing or also through looking at performance at school, talking with teachers, how are they doing on different state-based tests, for example, and that's going to give us more information about a learning disability. And typically there's patterns that we would look for in a child's cognitive profile and how their IQ testing looks that are consistent with a specific learning disorder that is different than what we see in a child with an intellectual disability. So even though those terms can sound really similar, it's important to understand that there is a pretty significant difference between a child with an intellectual disability or a child with a learning disability. So how do we figure out whether or not an intellectual disability really is the appropriate diagnosis? So the best thing that we can do to really answer that question is the psychological evaluation. And the psychological evaluation has many parts to it. So it's going to involve some sort of administration of standardized testing. That's going to give us that information about the level of functioning that's going to help us to make some decisions. But it's also going to involve talking with the family, talking with the individual, talking with their parents or other caregivers who are spending a lot of time with that person, Usually, if as part of a psychological evaluation, that will involve either what we call an interview or an intake with the family as a whole to talk about what are the difficulties we're seeing at home, at school, in the community, what kinds of behavioral challenges might we have, what are the learning challenges specifically. So we talk about that and get to know the individual. We also tend to use questionnaires that can be completed by a parent, a caregiver, teachers who spend time with the child and can tell us more about what types of behaviors are they seeing, what things tend to be difficult, how much help do they need across different areas, and then we can compare how these different individuals respond on these questionnaires to give us more information and more data. And of course, behavioral observations are another really important part of any psychological evaluation. So as an individual is participating in an interview or participating in standardized testing, we're observing their behavior to see how they respond across these different contexts, what their language is like, their mood, all sorts of different things that are going to be a part of this comprehensive picture that we try to create through a psychological evaluation. So for example, in our office here at Children's Resource Group, if an individual comes in for a psychological evaluation, they usually are going to participate in an interview with the psychologist first, or that intake appointment, and then they come back for some testing where we complete the standardized testing. We might have family members or others complete questionnaires, and we do those behavioral observations. So let's talk about what that measurement of the cognitive functioning really looks like. So as I've mentioned before, we're typically measuring cognitive functioning or intellectual functioning through an IQ test. And there are many different IQ tests out there. And I've listed a few here on the PowerPoint, just so that somebody who's looking for a reference of what those letters might look like when we are talking about the names of these tests. There are several different tests that can be used. The big thing is that the individual who's doing the testing is going to make a choice about which test they would like to use. And different things they might consider would be the age of the individual. So for example, that first bullet point lists several tests that are all from the Wechsler family of tests, but the WIPSI, that first one listed that's in the picture here actually, is the test that has been developed to give with children who are younger, who are more preschool aged, versus the WISC is for 6 years old up through 15 or 16 years old. So that's kind of middle childhood, versus the WAIS is an IQ test that's developed for adults. So part of this is going to be that the individual is going to choose a test based on the child's age, but there's other factors that might go into why someone might choose one test or another, such as the length of the test, the attention level of the individual, whether they want to do things that are more hands-on versus more verbal. So all of that's going to be factored in into choosing one of these tests. But the score that comes from any individual IQ test can be compared to the score from any other IQ test, because they're all measured using the same standardized scoring process. And typically an IQ test is going to be administered by a trained psychologist in a one-on-one setting. Usually that's going to be just the psychologist and the individual being tested. Occasionally, if a child needs support from a parent or is having a hard time separating, then there might be a parent in the room as well. But typically this is going to be a one-on-one setting, ideally with not too many distractions, where they can really try to do their best work. And cognitive functioning through an IQ test can be measured in a clinical setting, like a children's resource group or a hospital or other private practices that you might go to for a psychological evaluation, or it can be measured in a school setting by a school psychologist. And this is often part of the process of developing eligibility decisions for special education, completing an IQ test as a piece of that evaluation as well. And there's no difference between the type of IQ testing that might be done in a school setting or in a clinical setting. We're all trained to use the same types of instruments. So the other thing that we're measuring is adaptive functioning. And adaptive functioning can be a little bit harder to measure, but remember, it's the other essential piece when we talk about looking at whether or not an intellectual disability is appropriate. So part of the information that we're gathering about somebody's adaptive functioning is coming through the interview when we're talking with the family or the teachers about how somebody's functioning across different areas. But we also typically tend to use some sort of questionnaire. And on a questionnaire, usually what's happening is a parent, a caregiver, or a teacher is answering questions about lots of different areas of functioning. And they're rating, does the individual not have this skill yet? Do they have the skill, but they need support or reminders to complete the skill? Are they completely independent on that skill? And there's two examples listed here of different questionnaires that exist. One is called the Vineland, one is called the ABAS, but they're both pretty similar. And typically these types of questionnaires can be pretty long, but they're really important because they give us really good information about, we can look at how the individual responds to how independent the person is across these different areas. And then we can compare that to other people their age. And then we get a sense of, are these skills delayed? And if they are delayed, how much are they delayed? So once we've completed all of the pieces of the psychological evaluation, what we tend to do is look across all of the information that we've gathered, the information from the standardized testing, the interview with the family, with the individual, what we've observed, questionnaires we have completed. We take all of that into consideration to determine whether or not that diagnosis of intellectual disability makes sense. And then the other piece of information that we're going to consider is the level of the intellectual disability. So this becomes important because the level of the intellectual disability often drives what services are going to be appropriate when we think about planning for the future, what's going to be needed. So it's really important that individuals are also paying attention to the level of the intellectual disability. So this chart here is in by no way an absolute resource, but it really gives us a sense of how severity level is determined. So the first level of intellectual disability would be what we call a mild intellectual disability. And individuals with a mild intellectual disability may take longer to learn skills, but they typically are, for example, learning to talk, have the ability to learn some self-care skills. They're able to learn at school, but they perhaps require a smaller group setting, lots more repetition to learn skills, but they typically are able to acquire some academic skills. Sometimes individuals with a mild intellectual disability are able as adults to live independently on their own with minimal support from others. Sometimes that might not be the case, but a lot of times if we do our best to really prepare and practice the skills, they are able to do that. So the IQ score for an individual with a mild intellectual disability is typically going to fall around the range of 50 to that 69 or 70 range. And we typically would think about that as an adult, this individual may be functioning somewhere in the range of around a 9 to 12-year-old, what we would consider in typical development. So that's the level of intellectual disability that we call mild. The next level would be what we call a moderate intellectual disability. And an individual with a moderate intellectual disability may be slower at their acquisition of language. They're typically, as adults, going to require more support in the community. With a lot of work, they may be able to learn, for example, how to read or to master some basic reading skills, but there's a little bit more of a delay than we see in the mild range. So this is typically individuals whose IQs are scoring around the 35 to 50 range, and we typically think that as an adult, these individuals are functioning similar to a child between 6 to 9 years of age. The other levels of intellectual disability are what we call the severe and profound range. And when we talk about individuals who are falling into this level of intellectual disability, these are individuals that are going to need significant support from their environment. for the rest of their life. They're going to need assistance with self-care. They're going to have a hard time understanding safety. An individual may need support with mobility, for example, at this level. They may be in a wheelchair. They may not have the ability to communicate very functionally. So these types of individuals often are going to require a high level of support from their environment. And so when we talk about an individual with a severe or profound intellectual disability, we have to think about making sure that we are doing everything we can to keep them safe and to help them to have a high quality of life despite their difficulties with a lot of the daily living tasks that they're going to need support from those around them to get through their day. So one of the most common questions that will come up when, for example, a child is diagnosed with an intellectual disability is that families might want to know why. Why did this happen to my child? And in some cases, we might have some understanding about what could be reasoning for why an individual has developed an intellectual disability, but sometimes we might not. So in about 2/3 of cases of intellectual disability, we might be able to identify some sort of cause, but about 1/3 of the time, we're not able to do that. The types of things that might really increase the risk of a child having a neurodevelopmental disability or specifically an intellectual disability are things like genetic disorders, exposure to alcohol or lead in utero. Issues with pregnancy or delivery can increase the risk of having a child with an intellectual disability. And then, of course, neurological disorders that can be associated with brain development that kind of goes awry. So diagnoses such as epilepsy or CP are often associated with an intellectual disability. But as I said, there's about 1/3 of the time where we're not sure why a child is born with an intellectual disability. And that can be a very hard thing for a family to hear or to understand. But what I always try to assure families is that typically this doesn't necessarily change the course of treatment. In some cases, if there's a known medical cause that might be related to certain medications or treatments or things that we can do to help a child, but a lot of times the way that we're going to respond, what our teachers and our other providers working with this individual are going to need to do isn't going to change based on the cause or where the intellectual disability comes from. We're typically going to respond the same way regardless. So other considerations that we think about when we're diagnosing an intellectual disability, we want to think about community or environmental factors. For example, if a child has experienced trauma or significant neglect, that might be impacting how they're performing, and that might not be a true intellectual disability, so we want to take those types of factors into account. We want to look at cultural or linguistic factors. If a child's first language is not English, but they're being given an IQ test in English, we want to consider how that might be impacting their performance. Are there cultural differences that might be impacting how they're performing at home or at school? We also want to take into account other disabilities that might impact functioning, such as physical disabilities. If there's a mobility issue, we want to consider how that might be impacting their performance. If there's blindness or deafness or other mental health diagnoses, all of that needs to be taken into consideration so that we're really looking at whether this diagnosis is appropriate or not. There's also frequent co-occurring conditions with an intellectual disability. So children who are diagnosed with an intellectual disability are about 3 to 4 times more likely to be diagnosed with another neurodevelopmental disorder, another mental health diagnosis, or possibly another psychiatric condition. So it doesn't necessarily mean that they will not struggle with other difficulties as well. The types of co-occurring diagnoses we might see in children with an intellectual disability include autism spectrum disorder, speech and language disorders, ADHD, anxiety or mood disorders, or even schizophrenia. So a child with an intellectual disability should continue to be monitored to see if they meet criteria for any other diagnoses. And individuals that are working with someone with an intellectual disability should be considering whether any of these other diagnoses might also be applicable, which might help guide or change treatment decisions, educational decisions, or things like that. So what does intervention for individuals with an intellectual disability look like? The first thing that we always want to think about is how can we adjust the environment and the expectations to meet the needs of that individual with an intellectual disability. So a lot of times this includes educating parents, siblings, teachers, or clinicians that are working with that individual to really understand what is an appropriate expectation, or think about how can we change our environment that we're creating for this individual so that they can be as successful as we want them to be. And a lot of times this also includes establishing realistic expectations. So we have to think about when we're trying to intervene for an individual with an intellectual disability, how are we going to help them learn? How are we going to reduce behaviors, for example, that might be getting in the way of their ability to learn or function in their environment? A lot of times it's not uncommon for us to see that behavioral difficulties can develop in an individual with an intellectual disability. For example, at school, we might see that children with an intellectual disability develop disruptive behaviors, perhaps because they're frustrated when expectations around them or what they're being asked to do is something that they don't have the ability really to do on their own. Perhaps they need more support. Perhaps we need to lower our expectations for what the work level is that they can complete. And a lot of times by adjusting the environment around the individual, we actually see that some of those disruptive behaviors may decrease or go down. So how do we adjust the environment, or what kinds of strategies can we use to be more productive when we're working with an individual with an intellectual disability? The first thing we might want to think about are visual supports. So because an individual with an intellectual disability might require more reminders, more repetition to get things done, how can we use a visual or some sort of picture or something, a cue that is in their environment that they can see to help increase their independence so that we don't have to verbally prompt all day long to move from one thing to another. So that's why also a schedule can be really helpful. So use of a schedule, sometimes a visual schedule that they can see that shows them what's coming next, can be really helpful. Typically keeping a similar routine from day to day can be really important and can really help reduce some of the anxiety that comes from that difficulty of understanding time and difficulty planning ahead. And because we know that transitions are hard, we often want to think about how can we allow for more time when we have to transition from one activity to another or one place to another. How can we generally just decrease the number of transitions that this individual has throughout their day so that they don't have to stop and start as many times? And then when we do have a transition, how are we helping to prepare them for that transition? Letting them know what's coming, helping to externalize time for them so that they can see, for example, maybe with a timer, they can see, okay, there's 2 minutes until I have to do something different. We know that repetition and reinforcement is the best way to teach a new skill to an individual with an intellectual disability. So that means we show them what they need to do, we tell them what they need to do, we model for them what they need to do, we repeat that process, and every time that they do complete the skill, we reinforce that. So we give positive praise or perhaps access to reward, like a sticker or some sort of edible reward that they enjoy. Could be time doing something they enjoy. But when we reinforce that and repeat the skill over and over again, that's how the individual actually starts to develop that skill over time. In general, it's important that we work to decrease the stimulation in the environment of someone with an intellectual disability. So for example, When we're having behavioral difficulties, if someone's acting out or is upset or anxious, it's typically helpful to talk less and think about how we can actually decrease the stimulation around that person, give them a chance to take a break, to calm down without talking or adding lots of people around them, which is a common response when we want to help. But perhaps we should just have one person who's the point person that comes when that individual needs that type of support. And perhaps we have a visual that we can use that cues them to calm down or take a break rather than talking to them. Another thing to think about is how can we infuse choice into the day-to-day life of an individual with an intellectual disability. So rather than just creating a schedule and telling them this is what they have to do in every moment across the day, can we provide choices? You can either do this or this. And that tends to help increase compliance because it allows the individual to actually have some say in what comes next and make some choices about what they would like to do. And it might be hard for them to verbalize that on their own. Finally, for some individuals with an intellectual disability, in particular if we see some co-occurring mental health diagnoses or other conditions, behavioral challenges, we might also consider medication as another form of treatment for individuals with intellectual disability. And sometimes working with a provider who really has an experience working with children or adults with neurodevelopmental disabilities can really help families to learn more about how medication might be a piece of the puzzle as well. So when we consider intervention, there's a lot of things that we can ask ourselves. The first thing we might want to think about is, am I asking too much too fast? Sometimes we may not even realize how many directions we gave in one particular time frame. Did we say too much too fast? And now the person is just confused about what they're being asked to do. So you might want to think about, should I step back? Can I be more concrete? Can I be more, can I be shorter in what I'm asking in this direction? And that can really increase compliance and can increase the individual's ability to learn. We also have to recognize that individuals with an intellectual disability have their own needs, wants, desires. There's things that they don't like, right? And we have to consider that the things that they would like to do and like to learn might be different than the agenda of all of those around that individual. So take that into consideration when you're thinking about what's going to help that individual to be successful and to be happy and to feel some agency in their life. So we want to establish a routine that is going to be fulfilling for that individual, but also not be overstimulating, which really goes back to that question of, are there things that, is there potentially too much that's going on? Is it potentially too stimulating when we have all of this happening at one time? And how can we maybe pull back some of what we're including in an individual's day? Provide more opportunities for breaks or for choosing an activity for enjoyment, for example. We also want to make sure that basic needs are always being met, not just for the individual, but for the caregivers too, because it's very important. So we want to make sure, are they getting enough sleep? Are they eating healthy? Are they getting exercise? Because of that difficulty with self and internal motivation, we might have to prompt these types of behaviors for the individual. We have to prompt healthier eating, going to bed sooner, getting some exercise, taking a walk, because that's really actually going to help their overall health and their overall functioning. So now I'm going to spend the last few minutes reviewing some resources that can be useful when we think about working with children or adults with an intellectual disability. This could be resources that will be helpful for families or providers. And while this is by no means an exhaustive list, I hope that it's at least a start. And that you can click on these links or Google some of these organizations to learn more. So I want to start by talking about resources you can go to for just general information about intellectual disability. The ARC is a national organization that is known for advocating and serving people with intellectual and developmental disabilities and their families. And the ARC has a local chapter here in Indiana called the ARC of Indiana. They have a fantastic website and a lot of really great resources for families or providers that are working with individuals with intellectual and developmental disabilities. There's also an organization called Family Voices. Family Voices provides information, training, and support to families and children with special health care needs and to professionals that are supporting that population. It's a family-to-family organization, so it's parents of children with special health care needs that tend to be who you can talk to and work with if you get connected with Family Voices. And they have a really fantastic website as well with lots of information, in particular when it comes to healthcare financing, if that's something that you'd like to learn more about. Nationally, there's also some organizations that might be helpful to take a look at. The American Association on Intellectual and Developmental Disabilities is kind of one of the premier national organizations that represent this population. They have a conference that you can attend to learn more. There's also the Association of University Centers on Disabilities that really focuses more on supporting research and policy changes that impact individuals with intellectual and disabilities. There's a really great YouTube web series that I also want to point out called Tuesdays with Liz. Liz is an amazing disability advocate in Washington, D.C. She also happens to have an intellectual disability herself, and she has a weekly YouTube series where she interviews people to talk about topics related to this population, and I think it's really fantastic. So that's another great resource that you might be interested in checking out. In terms of different government agencies that are important to be aware of, Indiana First Steps is the early intervention programming from birth to 3 years old here in Indiana. Every state has their version of this. In Indiana, it's called First Steps. This is a way for families to access free therapies if their child has delays in their development. This can include occupational therapy, speech therapy, physical therapy, or developmental therapy, and oftentimes this is provided in the home. So if a child is showing evidence of delays in their development before age 3, it's important to get that child and that family connected with First Steps so they can get some of those services. On the other end of the spectrum, there's vocational rehabilitation. Vocational rehabilitation, or VR, works with families who have an individual with a disability who's transitioning to adulthood and can work to provide support with transition to employment or to post-secondary education. That is another important organization to get connected with, typically during the high school years, to help with that transition. It's also important to know about the Bureau of Developmental Disabilities. There is a lot of information on their website about how Indiana supports families who have a child with an intellectual or developmental disability. I would like to point out that there are financial supports that are available for families and children who have this diagnosis. These are non-income based financial supports. So for example, the family support waiver is money that a family can qualify for that can be used to pay for therapies, case management, respite, transportation, adult day services. There is an application process that is required. I encourage you to learn more about this if that might be applicable. Family Voices has a lot of information about getting connected with the family support waiver. There's also another waiver called the Community Integration and Habilitation Waiver. And this is a little bit more specific. That's money reserved for individuals who have priority status because of specific circumstances, such as death of a caregiver, if there's evidence of abuse or neglect, or if there's evidence of some sort of extreme health or safety risk. So if an individual has an intellectual disability, they typically can qualify, for example, for the family support waiver, but there is paperwork that needs to be signed and there is a wait list for receiving these services. Finally, from an education standpoint, it is important to know about special education, and A lot of families want to know about pathways to graduation or what that looks like for their child with an intellectual disability. So I encourage you to learn more about that. There is a great YouTube link here about individuals in Indiana talking about what the certificate of completion looks like, and there is information about different pathways to graduation. There's an excellent organization in Indiana called InSource, where families can get connected with advocates who also have children who've been through special education to learn more about how they can navigate the special education system. And then also the Council for Exceptional Children is a national organization that provides information about special education. And finally, a last couple things here, with the transition to adulthood, many families have questions about their child with an intellectual disability when it comes to guardianship and supported decision making. That's the legal process in which someone is appointed to support or be responsible for another individual's property, their finances. And if a family wants to learn more about that, the ARC of Indiana has a lot of great information about this. There's also something called a special needs trust that allows an individual to have access to financial resources while not having public benefits taken away. You can find more information about this through the ARC as well. And when all else fails, if families have questions about these types of planning for the future, we absolutely recommend that they consult with an attorney through example, the Special Needs Alliance. So I know that I have just about run up to 1 o'clock. So I would like to say thank you very much for attending this webinar. We appreciate your time. If you have any questions, feel free to get in touch with us here at Children's Resource Group or visit our webpage. Thank you so much and have a great afternoon.